Hey everybody, it's Helen Birch here. I am a clinical hypnotherapist and sex therapist, and in today's video I'm going to be discussing when it is safe to resume sex after giving birth. So as a new parent, you may be wondering when it's safe to resume sexual activities after giving birth. And this is a common concern amongst new parents as the body goes through significant changes during and after pregnancy. So in this video, I'm going to provide some insight into the physical changes that occur after giving birth, when it is safe to resume sexual activity, how to deal with painful sex, and alternative ways to be intimate after giving birth. So the first thing that I want to discuss really is kind of understanding the physical changes that occur after giving birth. So after you've had a baby, the body goes through significant changes, including physical and hormonal changes. The vagina and also the sensitive areas between the vagina and the anus can be swollen, sore, or bruised after delivery. The uterus takes time to shrink back to its pre-pregnancy size, causing cramping and discomfort. Hormone changes can also really affect sexual desire and arousal. So, for example, the body may produce less estrogen, which can result in vaginal dryness, making sex uncomfortable or painful. It can also dramatically cause your libido to drop. Breastfeeding can also affect sexual desire and arousal. The hormone prolactin, which is responsible for milk production, can suppress ovulation and reduce estrogen levels. And again, this can result in vaginal dryness and a decrease in sexual desire. So a big question that I often get asked is, when is it safe to have sex after giving birth? So the general rule of thumb is to wait 6 weeks after giving birth before resuming sexual activity. And this allows the body to heal and reduces the risk of infection. However, it is important to note that every woman's recovery time is different, and it is essential to consult with your healthcare provider before resuming any sexual activity, just to make sure that they feel that everything is safe and okay to go ahead. It's also important to note that if you've had a cesarean delivery, it may take longer for your body to heal. And again, you should wait until your healthcare provider gives you the go-ahead before resuming sexual activity. But once you've got the all clear and 6 weeks has passed, then there's no reason that you should not be able to resume sexual activity, unless your mind is stopping you. So I also just want to talk about painful sex after birth and some of the causes and solutions. So painful sex is extremely common after giving birth, and the causes of painful sex can vary, including vaginal dryness, scar tissue, and muscle tension. And it's essential to communicate with your partner and healthcare provider about any pain or discomfort that you may be suffering during sex. Using a water-based lubricant or coconut oil can help reduce vaginal dryness and make sex more comfortable. Kegel exercises, which involve contracting and relaxing your pelvic floor muscles, can also help to improve muscle pain, improve muscle tone, and reduce pain during sex. If there is scar tissue that is causing pain during sex, then your healthcare provider may also recommend pelvic floor physical therapy or some other kind of medical treatment to help break down that scar tissue. However, lots of women just anticipate that there is going to be pain during sex. So, can you have an orgasm after giving birth? Yes, you can. You can have an orgasm after giving birth. However, it may take some time for sexual desire and arousal to return to pre-pregnancy levels. Hormonal changes, fatigue, and stress can all affect sexual desire and arousal. And lots of women are worried, especially if there's scar tissue, that an orgasm is going to cause something to dislodge. It will not. It is essential to communicate with your partner and take your time during sexual activity. Experimenting with different positions and techniques can help you to find what works best for you and what is becoming your new normal. It's also important to remember that orgasms are not the only measure of sexual satisfaction. So I'm just going to share some tips for resuming sexual activity after giving birth. When resuming sexual activity after giving birth, it's important to take it slow and communicate with your partner. So here are some tips to keep in mind. So tip number 1, wait until you're ready and have had the go-ahead from your medical or healthcare provider. Tip number 2 is to use lots and lots of lubricant. This can be water-based or coconut oil, and it's going to help reduce vaginal dryness and reduce any pain. Tip number 3, experiment with different positions and techniques to find what works best for you. Tip number 4, take your time and communicate with your partner about any pain or discomfort or fears that you might have. Tip number 5 is to focus on intimacy and connection rather than just orgasms. So what are some alternative ways to be intimate after giving birth? It's not really, if you are not really ready to resume sexual activity or have experienced some pain during sex, then there are alternative ways to be intimate with your partner. So I just wanted to share some of those ideas. So cuddling and holding hands, massages and other forms of touch, non-sexual intimacy such as just simply spending time together and talking, that does not involve your baby or your other children. Masturbation and self-exploration, so sometimes you need to get back to being able to touch yourself and feel comfortable with yourself before doing that with your partner. And remember that intimacy is about much more than sex. It's about connecting with your partner on that emotional and physical level. So I just want to talk about some sex positions that you might want to try after having a baby. So when resuming sexual activity after giving birth, it's important to find positions that are comfortable and reduce the risk of pain or discomfort. So here are a couple of sex positions that you may want to try. So my top sex position is spooning, and this is because this position allows for deep penetration while reducing any pressure on the vagina. My other tip is to have the woman or female on top, and this position allows the female to control the depth and speed of penetration while also reducing the pressure on the vagina and any other sensitive genital areas. There's also a side-by-side position, and this position is similar to spooning, and again it allows for that deep penetration while reducing the pressure and reducing any friction. There is rear entry, and again this position also allows for the deeper penetration while stopping any rubbing or any friction that is on the sensitive vagina or also on the tummy or any scar tissue that might be there. So remember to communicate with your partner and take your time to just find out what works best for you, and don't be afraid to say if something is painful and you want it to stop. Some sex toys to consider. So sex toys can be a great way to enhance intimacy and pleasure after giving birth. So here are some sex toys that you might want to consider introducing after birth. So there is vibrators, and vibrators can help reduce vaginal dryness and enhance sexual pleasure and get over that fear of having an orgasm. There is Kegel balls, and Kegel balls can help to improve pelvic floor muscle tone and reduce pain during sex. There is dildos, and dildos can be used for penetration, again to help get over that fear, and can also help reduce the pressure on the vagina and the stomach. Also, I just wanted to suggest massage oils. So massage oils can enhance intimacy and relaxation, and it can be used during sexual activity, before sexual activity, or just as an activity to be intimate with each other. But the key is to remember to communicate with your partner and take your time and just find out what works best for you right now. So, when to seek professional help for postpartum sex issues. If you are experiencing pain or discomfort during sex, then it is essential that you consult with your healthcare provider, as they can identify the cause of the pain and recommend treatments and things such as physical therapy, which can help alleviate the pain. If you are experiencing a lack of sexual desire or other sexual problems, then it may be helpful to consult with a sex therapist, and they can help identify underlying issues and recommend strategies to improve sexual satisfaction and intimacy. So, how can hypnotherapy help for postpartum issues? So, emotionally, it can be very beneficial. So, if you also have anxiety, that is stopping you worrying and having sex, if that anxiety is becoming too much to handle, um, when it comes to thinking about resuming sex, then you must look into getting some support. And hypnotherapy can help manage your anxiety around resuming sex, your change of body. It can increase your libido and arousal, and it can help you to let go of any shame and guilt that you may feel towards your new baby and the shame and guilt you may feel towards your partner. So please don't suffer in silence. If you experience pain or discomfort during sex with no medical cause, then hypnosis can help you break that pain tension cycle. So through an in-depth consultation, I can, or a hypnotherapist, can help identify underlying issues and recommend strategies to improve sexual satisfaction and intimacy. So embracing a new chapter of your sex life. That is simply what having sex after a baby is. It's a new chapter of your sex life. And resuming sexual activity after giving birth can be challenging and a rewarding experience. It's important to communicate with your partner, take your time, don't rush, and be open to trying new things. Remember that intimacy is more than just sex and that there are alternative ways to be intimate with your partner. If you experience pain or discomfort, then consult your healthcare provider, or seek help from a sex therapist. Embrace this new chapter in your sex life and really enjoy the journey. It's a lovely way to re-experience your partner, a bit like the start of a relationship. You're just getting to know each other's bodies again. So if you are experiencing pain or discomfort during postpartum sex, or if you're unsure about resuming sexual activity after giving birth, then please get in touch with me. I can help provide guidance and support to help you navigate this challenging and yet rewarding and exciting experience. Thank you very much for watching. I'll speak to you soon. Bye bye for now.